Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that dial. We're going to get right to the heart of things today. We're going to talk about the heart, okay? And I have 3 guests today, and we're going to get as much information as possible. And doctors don't make house calls, but we're coming into your house today to help you talk about the heart, what you can do to help yourself, and all the things that the advancements that we have in the doctor has. He'll tell us all about that, okay? But, you know, you have to realize that there's a lot of songs that are written about the heart, okay, like Heart of My Heart, and then Deep in the Heart of Texas, and then Heart and Soul, I don't know all the rest of that, and then Sweetheart of Sigma Chi, C-H-I, wherever that is, okay, and Heartaches, Heartaches, and then Pig of My Heart, and then Let Me Call You Sweetheart, Heart. That's what we're going to talk about. Now, this song book here is 200 and some songs, and I just picked out the songs that, you know, named about the heart. But how many words, how many songs, the words heart is in there? So the heart is very important, believe me, because my doctor's here today, and he's the one that, after I had a hip replacement, during the operation, my heart was going boop, 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 boop. It wasn't going, you know. But I survived. And my doctor, who was sitting next to me here, after the operation, he came over and says, Hank, he says, you know, your heart was going boop, 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 boop. It should have been going pop, 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 pop. So he says, you're going to have to get a pacemaker. So next thing you know, I get pacemaker. Next thing you know, pacemaker, a couple of years, something went boop, 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 boop. I had to replace it. So my doctor's right here. He's like an umpire. He calls it right, sharks, strikes, whatever. So my guest today, that's enough talking for me. Now, the rest, they're going to be doing the talking because they're going to tell you all about the programs that are right there on the front burner. Now, Dr. Robert Velasco, who is a local cardiologist. Now, if I can't pronounce all these words, don't worry about it. Don't worry about it. And cardiologist, and he's a consultant, okay, with the group of heart doctors, right? And then Dr. Gina Rosentrelli. And she is the medical director of Rittenhouse Pine Center. That Rittenhouse used to be Rittenhouse School there. That's where I went to junior high school there. And then George Miller, who's the administrator of Rittenhouse Pine Center, right here in Norristown. Okay, and let me tell you, I think I was one of the first assisted living homes in Norristown. Most of them, they used to build them way out in the suburbs. It was hard for people to get out to visit their loved ones. So that is a good thing right here in Norristown. Now, and we're going to hear from everybody, okay? But I want to start off with my doctor and talk about the heart. We know who's here, okay? Dr. Velasco, thank you for coming. Thank you for coming here. Now, go. Tell me about what heart failure. Tell me.
Well, heart failure is the most common cause of hospitalization currently in the United States. It's more and more common as people get older, and the population in general is living much longer than they used to, so it's sort of an epidemic that has been occurring with congestive heart failure. Congestive heart failure occurs when the heart's forward cardiac output is inadequate and the blood backs up, and the organs behind the heart get congested. So primarily that's the lungs become congested. They have additional blood in them. They become heavy like wet sponges, and people manifest it as being short of breath, period. They often will have difficulty breathing when they're laying down because the lungs are heavier. They may get swelling in their legs with it. They may get swelling in the abdominal cavity. There are several types of heart failure. In the older people, frequently they've had chronic long-term high blood pressure. The heart muscle has become thicker than normal, which we call hypertrophy, to compensate for working at a higher workload than it should be. And then the heart becomes stiff, and it's difficult for the heart to fill. Normally the heart fills up with blood like this, and then it squeezes. And when the heart is stiff, it squeezes okay, but it resists filling up, and that transmits back pressure into the lungs, which eventually leads to some activation of certain hormones, and people start retaining fluid. The other kind of heart failure we commonly see is when the heart muscle is simply weak, such as after a big heart attack, when the heart muscle, instead of squeezing like that, squeezes like this. And the treatments for these two different types of heart failure are very, very different in terms of medications. However, the long-term prognosis is about the same, and the symptoms that a person would have are about the same. When we see a patient with heart failure, we try and assess which type of heart failure they have and what the underlying cause is so that we can put them on proper treatment. And we also look for some cause of heart failure that may have a reversible component, such as blocked up coronary arteries.
Yeah. Now, okay. Now, when somebody has a heart attack and they have then you refer them to like assisted living or heart. Can you tell me now? That's where Dr. Rose comes in. What's the story on that? How's that work?
Because this is
You recommend.
very commonly a problem that people are hospitalized for. Very, very commonly, when the people improve in the hospital, they're not really strong enough to go home, and they need a place to go where they can take their time and build up their additional strength so that they can become independent again, particularly in the older population. Also in a population of people who may have just had open heart surgery, and they're older and they get out of the hospital, but they're not really strong enough yet to go home and become independent again. And that's the program.
That's where you come in,
Yeah.
right?
That's where I come in.
And you're a doctor, right?
Yes,
In
yes.
other words, when you work with, you just not drift away. You work close with her, right? On
Yeah.
this. Okay, tell us what you do now.
So I'm medical director at Rittenhouse Pine Center, which is called a transitional care unit. And in transitional care, we're helping patients who have been hospitalized with something like heart failure transition back to their home setting through an interdisciplinary approach where we use physical therapists, occupational therapists, nursing care, medical team with physicians, respiratory therapists, nutritionists involved, caseworkers, and we work with the patient to help them get stronger, help them manage their medications, understand.
That's at the Rittenhouse nursing
That's at
home,
Rittenhouse Pine
right?
Center,
What
yes.
is Rittenhouse? How do I put it? What's it?
Rittenhouse Pine Center.
Oh, okay, Pine Center. Well, okay, Pine Street, because it's on Pine Street. You know, I had a lot to do with that name. They wanted to call it something else. I says, no, I'll call it Rittenhouse, because I went to school there. Okay.
Gotta preserve
And
the
you're the
name, right?
administrator. Okay, go ahead.
So through the therapies and the education and through medication management, we're able to get these people more stable and stronger and help to get whatever resources they need for home to transition them.
But you're
then
there,
from-
you're there.
I'm there
Right.
every day.
See, I want people to know that, you know, you're there. Like you're
Right.
not just like a butterfly going from one place to another, right?
Right. In the past, the hospitals used to keep these people there for a longer stay so they could get their therapies
Right.
and get more stable to go home, but that doesn't happen anymore. So they come to a facility like Rittenhouse, and the difference at Rittenhouse is that I am there all the time, whereas most nursing homes or rehab places, the doctors come in, they see their patient, they go to their office, or they go do their other activities.
right.
But I'm there.
Now, Mr. Miller, George Miller, right. Now, tell me about Rittenhouse Pine Center.
And Hank, if you don't mind, I want to digress for 2 seconds. Thank you for having us on the show. I've been an admirer of you for many, many years. And
Well, thank you.
As a young kid, I could recall you coming around to the schools and
I never cross when the light is red.
as a police officer and doing those,
Thank you.
very, very nice safety clips for
That's what I want to tell
for
these
the kids.
We have people enough from outer space. They're right here, local.
Exactly.
Okay, they care about everybody here. Go ahead.
Thank you for that. Genesis Rittenhouse Pine Center is a center that's been here for 15 years, right here in the Norristown area. We're operated by a larger company called Genesis. We have 230 facilities up and down the East Coast. We operate in 13 states. And just in this listener area, we have probably 25 facilities between Philadelphia, the main line, sprinkled through Flourtown,
right.
and so on and so forth. Our main focus at Rittenhouse is this. We're the bridge for those people who are coming out of that hospital setting, who maybe just had a surgery or have a medical condition, and we're bridging and we're focusing on their rehabilitation in our center.
Yeah.
And we can talk about our clinicians and so on and so forth in turn, and partly we're talking about the medical clinicians right at this point. But we have many folks who are rehab specialists, such as physical therapists, occupational therapists, speech therapists, along with our nursing clinicians who have expertise and have additional training in cardiac kinds of conditions.
But I
So-
understand you're improving. There's some improvements going on right now.
Yes,
I
absolutely.
see there's a lot of construction going on there. What's going on?
We've got construction going on. We're doing an entire facelift from inside top to bottom. We're making private rooms where we did not have before.
Okay.
And amenities that you typically wouldn't find in a center like this that are more hotel-like than you would expect, such as internet capabilities. So people who want to maintain communications at home or at work, they can either use our computers,
Right.
their own computer. We've got a chef on board, so very shortly after these renovations.
I know the
we'll
food
have-
is good. I've had
we'll-
lunch there quite a few times. So.
We'll have a bistro, we've got, get all
Right.
the typical
A little
guests.
bit of pasta mazou.
Exactly.
Okay.
We'll
Now,
have it when you're there.
all right, and I know Campagna, we helped put a flag
Yes,
there.
yes.
But you know what happened? When they were building that place, I knew the owner was building it, and they built a thing where it's gonna be, where the flagpole was gonna be. So I told the new director, I says, they're supposed to put a flagpole there. And he says, no, we're gonna put a bush there, or a tree or something. So they put three. About 2 years later, the tree died. So they called me and says, I think you better put that flagpole up there. I think somebody give him the maloik, And so I called the Campagna, they come over, we put a big ceremony, we have an American flag. So when you go by Rittenhouse Nursing Fine Center, why, you'll see an American flag there, pole right in front of the place. Patriotic. Now, back to you, Doc. Tell me, what's new? Cardiology, what's new? I had someone who was telling me something about now if somebody has something to do with the blood, the brain or something, they can, rather than cutting it open and something to dissolve it. What's going on?
Well, one of the new things relevant to what you just said is that a lot of people have a condition, especially common as they get older, probably more than 10% of the whole population from the age of 80 on up.
I'm 88.
I know.
88, baby. Hey, you know how many keys there are in a piano? 88. And I played every key. White and black key, bop, 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 every one. And I made sure for the 88 years, I spent my time. And your son, Nicholas, his son is right now in Russia. He conducts a big orchestra. I don't mean like 15 guys. I mean about 60, 70 people. And he's going to put a concert out here in Norristown later on. We'll talk about that later. Go ahead, Doc.
Well, atrial fibrillation is a condition where the top part of the heart, called the atria, where the blood is received, instead of conducting rhythmically with the bottom part of the heart in sequence, the atria just wriggle around. It's not a life-threatening condition, but people can feel uncomfortable with it. But the major issue with respect to the risk for strokes is that the blood that's right along the edge, instead of getting squirted and moved, just becomes stagnant, the blood that's right at the edge of the lining of the heart there on the atria. And if a clot can form. Whenever blood is stagnant, it often will clot. And a piece of that clot could break loose and migrate through the arteries and land in the brain, which would cause a stroke.
Yes.
And it's a common cause of stroke. And atrial fibrillation, which is extremely common in older people, is a major risk of stroke. The risk can go up to as high as probably about 15 to 20% per year in some of the older people. The treatment for that traditionally has been a drug called warfarin or Coumadin, which is an extremely difficult drug to use because it interacts significantly with people's diet. It interacts with other medications. Sometimes I think it interacts with the weather because the degree of blood thinning you get from it is so inconsistent and erratic that even in the best of circumstances, only about a half or at most 60% of the time, the blood's actually in the appropriate range. When the blood is too thin, there's a high risk for bleeding, and when the blood's not thin enough, there's a risk for clots. And it's very hard for the patients to take. They need constant blood testing and monitoring. In the past 2 years, 2 new drugs have come out, one of which is Pradaxin, another which is Xarelto, which work by a completely different mechanism. They're very easy to use. They don't interact for practical purposes with any other medications, and they don't interact with diet, and they don't require any blood testing. Like any blood thinner, there's a risk of bleeding. Any kind of blood thinner, whether it's aspirin or Plavix or Effient or these new drugs or warfarin, has a bleeding risk.
Wait. Run that by me again now.
Well, any drug that's a blood thinner that reduces the ability of the blood to clot.
Is an aspirin a blood thinner?
Yes. And it reduces the ability of the blood to clot. You can have bleeding as a complication.
Well, I take a little baby thing every day. Is that good?
Yes.
Good.
Well,
Must be working. I'm still here, baby.
Yeah. But the newer blood thinners do not have a higher risk of bleeding than warfarin, and I think in real life they actually have a lower risk because the studies that are published have artificially good results because they're done in an ideal situation, which doesn't really apply to the real world. And in reality, we see a lot of bleeding complications with warfarin, and we've seen a little bit with the newer drugs, but I think warfarin was because it's like a car with a loose steering wheel. It's very hard to manage them. It's very easy to manage the newer drugs. It's very easy for the patients to use. And I think these two new drugs that have come out have been a gigantic improvement in our ability to take care of patients with problems like this.
Not to interrupt you, but is there more technical or new procedures on diagnosing a problem without opening somebody up?
Well, I think
What are some of the newest things I know X-ray and stuff like that, but what to diagnose something that you got a problem? What's the most
about,
important
like,
thing you would use?
Cardiac CT things.
What?
well, probably to look at coronary arteries by CT angiography
What,
is
do they have to go through your veins or something that puts?
No.
Would they put some fluid in there and everything? I don't know.
it's
Tell me.
It's a very, very helpful test in ruling out coronary disease in a population of people where there's a low likelihood of doing that. And the problem with it right now is that there's a lot of radiation involved, a great deal more radiation involved with a cardiac CT than would be involved with a traditional cardiac catheterization, which is slightly invasive to do that because you have to introduce a catheter through the blood vessels, and it has to be done by a highly trained person. But eventually, looking at coronary arteries by CT, I think the technology will improve enough. It's improving rapidly now.
Rapidly, right.
That the amount of radiation involved. My major issue, and I don't order very many of them, is there's a huge amount of radiation involved. And the other is that the ability to discriminate between coronary atherosclerosis, which is hardening of the coronary arteries, which is present but not severe, from the degree that severe is limited. And it's also very limited in older people who have very heavily calcified vessels. And the calcium reflects the X-ray beam so brightly, it's like when somebody shines a bright light in your eyes, and it's really, really hard to see accurately past that. And the third is people who have irregular heartbeat, which is also common in older people. It's very hard to do this test because the test has to be timed with each heartbeat to take the pictures. You have to time it. And if the heartbeat's irregular, like with the atrial fibrillation, it's hard to do. So there's significant limitations right now. I think the technology is progressing rapidly enough that over the next few years, it may become a way to not have to do as many catheterizations. But right this second, I don't really feel that it is for the heart. There's a lot of testing in certain types of diseases where
That's
MR,
what testing, that's the word I got.
like magnetic resonance, is coming on in the cardiac research area. There's a lot of testing to look at masses in the heart, cardiac function, and to try and determine whether heart muscle's dead or alive with MR. But again, mostly it's in the research arena right now. It's not particularly available to us very readily. I'm hoping when we have the new hospital, we'll have a lot of these
Tell
more
me about
advanced
the new
techniques.
hospital now. What's new there? What's going on?
Well,
I had some people from Einstein here, and I've had them from Suburban. Suburban told me they just have a new kind of Da Vinci.
Da Vinci.
Da Vinci.
Robotic surgery.
Yeah,
to do surgery.
Yeah, and
It's not cardiac.
and now Einstein, the top people that was here talking, they said something about they're going to deliver babies, they're going to do open heart surgery, they're going to do a lot of things. So you're going to be involved there, right?
Yeah, we'll be the cardiologist there. From the heart
Are
standpoint,
you going to be at
Yes.
Einstein?
absolutely. From the heart standpoint, we're going to have open heart surgery, which we've never had in Norristown before. And Einstein has brought in a surgeon named Mark Anderson, who has a national reputation. He's from out of this area. He's starting on Friday at Einstein in Philly, and the new hospital opens September 29th, and he's creating his team now and getting it ready to go. And this is going to be a huge advance because I think we're going to have probably among the very top open heart surgery availability in the Philadelphia area, not just the suburbs, but the Philadelphia area.
Now the hospital, they'll be working along with you, like sometime after they need assistance, like can't go
Right.
home, but yet
Right.
that's where you're coming.
Yeah,
right?
absolutely. We have great relationships with both hospitals, both Mercy and Montgomery, and future Einstein.
Good.
So
You know, when you diagnosed that on my pacemaker that I had an infection around it, and then you said, well, let's look and see, maybe use some kind of antibiotic, but it didn't work. Then he called me back, says, look, it's not working. You have an infection, and if that infection is underneath the pacemaker, going to your heart, you're going to have a real problem. You pick up the phone, called Lacanol, and he says one of the top doctors down there, he was available. I understand he was tough to get. Dr. Ferdinand, right? And you bobbed and weaved and got me down there. I think within a day or so they operate, and I come out of it good, And like I said, when I was in the recovery room, I heard that music on lullaby and good night, and here I thought it was in heaven. And here they play that every time a baby's born, and it played 6 times. So they had a busy day that day, So, well, now you have 2 hospitals now that have all the top stuff, How does that? I don't want that. Maybe that's not a question for you because you're a doctor. You're not an administrator running that stuff. But is that going to be a competition or something, or people have a choice? What's the story on that? I don't know.
I think what's important is that people have a choice.
In other words, it's your choice. Whoever
Right.
your physician says where you want to go, right?
Right. Where your physician goes tends to be where you're going to want to go.
Yeah.
But as a person, as a patient, you have a choice to what hospital you want to have your care at. And that's important because not everybody wants the large hospital. Some people want the smaller, more community set hospital, and other people need procedures, things that are done at a larger facility, and don't want to go to the city to have that done. So having the local capability of a larger tertiary care center, I think, is going to be important for that population who needs
Now,
that.
when a patient is sent from him to you, and you follow up on it, okay, what's like a rehab or so? What's
Right.
the school? What do you do?
So when a patient arrives at Rittenhouse Pine Center for their skilled rehab time after a hospitalization, they're evaluated by me as the physician, making sure that medically they're stable and managing their medications, their blood work, their studies, their tests from a medical standpoint. They're also evaluated by another physician who's in charge of the rehab part of it, a physiatrist. And he helps develop with the physical therapy, occupational therapy, speech therapists, the program in that end of it to help them physically gain their strength back, while medically I'm working that end. And then the nurses, they're available to carry out the plan. The social work works with the family and the patient to help with whatever needs they have for community resources after they're there. So I'm there every day seeing the patients and working in conjunction with the therapist and the physiatrist. And then we do have weekly rounds with the cardiologist too. So Dr. Belasco, for example, comes into Rittenhouse once a week and through...
I live right 1 block away from it.
I know, right? So you
I'm
can
1
come
block
by and
away, so you
visit.
can stop and say hello to me.
Okay.
And you can stop in and
You know
visit
where I
us,
live.
too.
You've been there, right?
1725.
So we have a list of patients who are high-risk cardiac patients, and those are identified and they're given the same interdisciplinary approach to their care directed at improving their cardiac status. And Dr. Belasco will come in and run through those patients with me to make sure that we're doing the right thing for them,
Good,
cardiac-wise.
All right, Doc, tell me now, we're running out of almost time. We got some more time. Tell me some more things that are helpful or prevention or whatever, anything that you can add on here that will be helpful,
One of the other new things that
new things.
will be available, though not immediately in town, is that aortic stenosis is another extremely common, almost like an epidemic in older people above the age of 80, where the aortic valve is the last valve that the blood has to go through before it leaves the heart and goes out into the aorta, which is the large artery which distributes blood all over the body. And a lot of people, the valve becomes calcified as they get older and it doesn't open. So the heart's squeezing very hard to pump the blood instead of through an opening that big, through an opening that's only this big. And traditionally, the only treatment for that has been open heart surgery. There are no medications that work for that. And
That's a last resort.
well, when people start to have symptoms, the only treatment has been open heart.
Yeah.
And doing open heart surgery in older people has significant risk.
Yeah.
So a technique has been developed, which currently is now was approved by the FDA last fall and is only available.
What do you mean it was approved? It has
The
to be
FDA
tested?
it was being tested before, so I've had about 5 patients already undergo this. And all 5 of them were done as part of the study, which was being done at the University of Pennsylvania by Dr. Bavaria. And the valve can be replaced by introducing the valve apparatus in from the groin and then sliding it up the aorta. This is surgery, and it's done under general anesthesia, but it doesn't require cutting the chest open at all. So it's much, much less surgery than traditional open heart surgery. And sliding the valve up the aorta around the arch of the aorta, which is like a U-turn shaped like a question mark, and then a balloon dilates open the tight valve, and the apparatus is inserted in there and then expanded, kind of like opening a umbrella. Right. And the valve opens, and the data for this so far is very good. The indications currently will be for the very older population who would be very high risk for open heart surgery. It would be the people initially getting this, because the long-term outlook is not known. It's been available in France for several years now, and they've probably done many thousands of people in France, but it just became approved in the United States. Dr. Bavaria has probably done about 300 at the University of Pennsylvania. Wow. Of these, of which I've had 5 of my patients done, 4 of whom have done very, very well. All of them were old enough and sick enough and frail enough that traditional open heart surgery probably would have been more of an execution than a treatment. Yeah. And so this is a huge area, and eventually, as this technique is more and more refined, probably it will become more applicable to people who aren't as older, and will be able to have open heart surgery without actually cutting open the chest.
And that will be, you're going to be doing that at Einstein.
Yeah.
Right, right. I don't think Suburban's doing that.
No, they don't have any heart surgery.
But they'll deliver babies. So the babies be born, right? Yeah.
Suburban doesn't have OB.
No, that's right. Suburban don't. Einstein's going to deliver us. So I got them mixed up there. Well, we're going to do have a baby here and a baby there. What are they going to do, you know? Or just like Lawrence Welk says, keep a song in your heart, you know. And, you know, and then I don't know if he was around today. I'd say keep a song in your heart, keep a prayer in your head, and keep a gun in your holster. I don't know. That's the thing today. I don't know. I don't want. Okay. Now, you know, I'm so proud that Rittenhouse 15 years ago came into Norristown, and you've helped a lot of people in Norristown. I mean, a lot of my friends, patients there, I was able to visit them, you know, and it really was, it made me feel good that I knew that some of my friends were there, you know, and you're doing a good job. So I'm very proud, and you're there helping out, and you're sending patients over there in good shape, and then she gets them back in shape, and then you help them out the door, right? All right, what else? What else we got?
Well, one other thing I wanted to add a little bit on the program there is the patients.
Oh, yeah, tell me about this program.
Family physicians who may otherwise would be going to see them at a nursing facility are still able to participate in all this.
Run that by me again.
If a person has their own family doctor who normally would go to a nursing facility, can still be participant in all this. This is not exclusive of any of the other primary care physicians that a given patient who goes to Rittenhouse might have. It's everybody works together. Okay. This is not like a tug of war with the patient being the rope. It's everybody trying to work together to get the patient.
We can elaborate on that?
Yeah, we've got a great relationship with the community physicians. And obviously, Dr. Rose is there to supplement, but also we can name them. We've got Dr. Dickerman, Dr. Yarmark, Dr. Priya Vazdev, Dr. Perlstein, Dr. Roman, and on and on. So each of these physicians follow their patients at Rittenhouse Pine Center. So.
Right. All right, tell me something about you.
Something about
What
me.
school did you go to?
Well, I'm actually born and raised kind of locally. I went to North Penn High School.
Oh, yeah.
Yeah, I grew up in Lansdowne. Right. Went to North Penn High School, and for undergrad, I did have to leave the area for a number of years to kind of stretch my wings a little bit. I went to Cleveland, Case Western Reserve University.
Right.
And I did my undergrad there, then came back and went to Temple for medical school. So I ultimately got my degree from Temple, and then...
Right. You know, when we come in here to the studio, Dr. Blasco looked at me when I was a policeman, I was on a motorcycle. You know, if you ever see a guy riding around with a motorcycle, it might be Dr. Blasco. He's a motorcycle guy. Two-wheeler, right? Tell me something about some of the rides you take.
I was just in Tennessee on Saturday.
You what?
Last Saturday, on Thursday, I rode down to Tennessee and came back on Sunday. Yeah.
Oh, my God. what's his name? You should have checked with, what's his name? Stan Husky, the editor of Times Herald. He's from Tennessee.
Is he?
Yeah. So, and, okay, how about you? You're
Born-
all local,
Born and raised in Norristown.
right?
Yeah, Norristown High School and.
High school, Norristown High
Yeah,
School.
Norristown High School, Temple University, yes,
Oh,
all the way.
that's great, great. Now, so tell me, what's new? What, I mean, what do we see up front coming up with new hospitals? How about the training of doctors? Is that improving? What's the scoop on that? Philadelphia, I guess, is one of the major cities for educating doctors, I guess, isn't it? I wouldn't say.
Yeah.
You think so?
Oh, Philadelphia is one of the top cities in the United
What
States.
school did you go to?
Temple,
Temple. And then
for medical school.
Temple's Medical School.
Same as Gina.
Same as that. Oh,
Yep.
Local,
Same as me.
right? Nothing wrong with that, you know? All right. Now, and how long you been practicing?
33 years.
33 years.
Actually,
All right.
actually 34
Now,
years.
another thing we didn't know about, you know, he's got a lot of history behind him. His son directs a big orchestra and symphony orchestra. That's what he said. And your wife is one of the top doctors down at Children's Hospital. What does she do? Tell me something about her.
She's my
She
classmate.
was supposed to be here, but she couldn't get up because of schedule, right?
Yeah, she's my classmate at Temple, and she is a neuro-oncologist, which means she takes care of people who have children who have brain tumors and spinal tumors and any tumors in the nervous system. And she's an oncologist primarily, not a surgeon. And right now, she has a huge practice at Children's, and she wasn't able to come because she's attending the entire inpatient floor this week, in addition to having her huge outpatient load. So she gets home around 9:30 or 10 o'clock at night, which is dinner time in our house this week. So that's why she wasn't able to come today.
Oh, yeah. Well, we'll get her here. We'll get her in September. This is my last show for the summer, but starting in September, we'll get you back next year one day with
Okay.
with you. And I'd like to get your son here, the whole three family, musician, the doctors, and whatever, you know. So, all right. Is there anything else you want to add?
Well, always be prepared. Always be, as an individual who's potentially having surgery or going into the hospital or anticipating, be prepared for, are you able and are you going to be well enough to leave that hospital and go home? And if not, where are you going to go? And keep in mind, pick up the phone and call Rittenhouse Pine Center and ask for a tour, and we'll be glad to show people around.
And you also assist, like for insurance, make sure that people,
Absolutely.
you help them out. You help them out when they come out of the hospital, or make sure that, yeah. Now, one other thing, you're going to be now short stay, right?
Yes, for a number of months, we've had a growing focus on the short stay patient. And what short stay means, anywhere from a few days to a few weeks. Again, we're being that bridge for those people who don't have the personal or physical ability to go right home and start their daily activities. So lots of folks need rehabilitation, and again, that's where our expert team of therapists comes into play and our clinicians come into play, and that's it's the wave of the future. That's, if anything, that's one of the future things.
Good. Well, I know I have a brother-in-law that had to go to a nursing home, so he's really needing real, but you couldn't take him because you're taking short stay.
Okay.
But you do have some are in there,
We
but
do.
you're not kicking them out.
Right.
Correct.
No,
No,
you're going to
no.
keep them there, and then, all right, yeah, but that's what I heard when I made a phone call, see if you could get them, said no, but they're not kicking them out, but it's
Right.
going to be short stay from here on in,
I think one of the things that people don't realize is for any one day that you're laid up in a hospital bed, getting treatment in an acute care setting, on average, it takes about 3 days to recover the strength that's lost for that one day. So if someone's in the hospital for 5 days, that's upwards of 2-3 weeks of therapy to recover that lost strength. So it's hard to go right from an acute illness right back home where you might not have the resources available to help take care of you. So a place like Rittenhouse offers that 1 to 2, 3 week bridge to get them home. One of the things that a lot of people come in with is that fear, though, of I'm coming to a rehab, I'm not going to go home. And we're trying to take that fear away by having it just be short-term transitional care and rehab. They're coming in knowing that we're not going to keep them. We're not going to make them
Yeah,
stay
yeah.
here and tell them they can't go home. So our goal is really to get people strong enough and safe enough to go home.
You know, one of the biggest problems, I guess, now that people, the older they get, that they don't know, they can't take care of their parents, you know, and I think that, what do they say, an informed nation is a peaceful nation, an informed nation is a healthy nation. So pick up the phone, call, say, look, I don't know, what can you do to help me, or so, you know, that's one thing I'd say, that you have someone available to give that information.
Absolutely.
Because, you know, people are afraid or they're embarrassed or whatever it may be, you know, and to get the people to know what's out there.
Just to come in and look around and talk to the admissions, coordinators, the social workers, to find out, because even if we don't have the facility that's right for you or the loved one that you're worried about, we have resources available to help identify what those needs are and how to make them happen. So
Right.
I think that's really important. Is it's Rittenhouse might not be the place you're going for rehab, but it might be the place you get the answers for what your needs are and where you need to go.
Good. Give us a couple tips now. So, in reference to the heart, what we can do to help ourselves and don't cause any problems for our heart. What are some of the things, the key things? Exercise or so?
I think exercise is it. As Gina just said, that if a person comes in the hospital and they're only in bed one day, it takes 3 days to recover that strength. There is absolutely no doubt when somebody is physically fit, keeps themselves in good shape physically, when they have an illness, they do much better. Their chances of recovering are much better, their chances of surviving are much better, and the amount of time it takes to get them better is much better. Whether they're going in for an operation or whether they have an infection or a pneumonia or something like that, or a heart attack, no matter what it is, especially as people get older, the physically fit people do much better. So the thing I constantly prod my patients is to get off their butts and to go out and just walk every day for an hour or so.
Wow. An hour?
Well, if you stop,
Well, whatever.
you remember,
How about if I sit in a chair, go like this, that little exercise, that's
better than nothing.
better than, you got it. You got it. So, all right, what else about food? Manja, what
Well,
foods
just
you can
really
mess you
just
up?
trying to keep people from being so obese.
Don't eat too much.
Yeah, people the degree of obesity is incredibly harmful to people in many, many different aspects of their health. And it's just, it's almost an epidemic everywhere you go. You see extremely large people. And 50 or 60 years ago, you didn't. If you look at a picture from an old Life magazine of the United States, 1955, hardly anybody's overweight in a photograph. And now, anywhere
Yeah,
you go to a mall,
yeah.
you go to a shopping center, it's hard to find a person who's not,
Yeah.
who's thin.
I go, what's the name? I go in some of these here shopping centers and all, with Lakehurst. It reminds me of Lakehurst Airport. You know, that's where all the dirigibles are,
Right.
you know? I go in the restaurant, I see all these blimps going around there. I said, where am I, Lakehurst Airport? You know, it looks like a blimp flying here and there, you know? Come on, take it easy. Don't eat too much. Take it easy. Manja, listen a little bit, you know? Don't be a kaboom. And that means don't be a hog, you know, in Italian, so whatever it is. So, right. Doc, you're looking good for, how many, 33 years doing that? You look good. Look like you could go right back in the ring or so, right?
Preferably on a bicycle.
But riding that motorcycle keeps you alert. Then, you know,
Yeah.
and you ride all the way to Tennessee
Yeah,
by yourself?
yes.
Hello there. I rode the motorcycle. I was getting paid, but I wouldn't do. I wasn't. How about when you're going along and cars open their doors? Isn't that a problem?
Well, you
In-
try and
when you're
stay
in
away.
town.
You try and stay far enough out that you have enough. If the
Right.
door opens, you're further lateral to the car than the dimension of the door. You have to watch that closely, and also you watch the parked cars whether their wheel starts to turn, which means they're about to start to pull out.
Got to be alert. Right. Okay. All right. We're getting a single that we're gonna. The party's over. La 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 la. Listen, I have a little gift for everybody here.
Thank you.
Little token
Oh,
of
thank you very
appreciation.
much.
And for my 23rd year
Thanks, sir.
finishing up, where's my cake? Somebody bring my cake out. Get the cake if you can. And here's one for John Doyle, you know, for his support and allowing me to come in here and cause some problems and whatever and sing out of tune and all, whatever. And I just want to thank the whole three. I'm telling you, I'm so happy to see you. That every time I went in your office, a couple of times, you know, when I was laying in bed, and you always says, Hank, your heart was going boop, 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 you know, and I says, oh. But here we are now, healthy, right, ready to bob and weave. So, Doc, thanks a lot. Thank you very much.
Thank you.
And I'll be stopping in there. I've dropped some pretzels off to the help bear. So, ladies and gentlemen, thank you very much for allowing us to come into your home. And may God bless each and every one of you. And keep bobbing and weaving. And like Lawrence Welk says, keep a song in your heart. And that's what we talked about. We talked about the heart. So from my heart to your heart, God bless. Adios, amigos. Right, alla salute. And then that means to your health in Italian.
Happy days.
Right? Alla salute.